Hello, my name is John Gordon, and I'm going to give you a quick lesson on Behavioral Emergency Code Gray, Memorandum Number 6012. Policy. The medical facility clinical staff are responsible for responding to Code Gray emergencies, with the assistance of other staff members from adjacent inpatient and outpatient clinical units, and if necessary from the VA police. Verbal interventions should be emphasized as a primary measure with the use of physical restraints, only when alternative forms of use have been exhausted. Delegation of authority and responsibility. The Chief of Staff and the Associate Director for Patient and Nursing Services will ensure the proper dissemination of this policy to all parties that are involved. The Disruptive Behavior Committee will oversee behavioral emergency Code Gray calls. The Disruptive Behavior Committee will ensure the medical facility clinical staff are trained at a level that is conducive to them being efficient and effective in carrying out the guidelines and procedures on how to handle Code Gray behavioral emergencies. The nurse manager, charge nurse, designee will be responsible for the coordination of the code, and the Code Gray evaluation forms are completed in their entirety within their respective units. The medical director, designee of outpatient, will be responsible for designating a code leader and that the Code Gray evaluation forms are completed within their respective units. Clinical service chiefs will be responsible for ensuring that the clinical staff is compliant with this policy. Actions and procedures. Initiating a Code Gray. All medical facility personnel may initiate a Code Gray. Activate by calling extension 7999. Provide location, division, building number, unit, room number. Stay on the phone until the telephone operator acknowledges receipt of all pertinent information. The telephone operator will announce the code and its location via the public address system and simultaneously send out the alert to all pagers. Composition of the Code Gray team, Uptown Division. Unit charge nurse, unit nurse manager or patient care coordinator after regular business hours, unit psychiatrist or the MOD after regular business hours, VA police. Inpatient nurse managers will designate staff on each shift to respond to Code Gray in any area of the Uptown Division. Available employees trained in Prevention and Management of Disruptive Behavior, PMDB. At a minimum, one staff member should be designated from each treatment area during business hours. Composition of the Code Gray team, Downtown Division. Unit charge nurse, unit nurse manager or patient care coordinator after regular business hours, consultation liaison psychiatrists at the Downtown Division, VA police. Inpatient nurse managers will designate staff from each shift to respond to Code Gray in any area of the Downtown Division. Any available employees trained in Prevention and Management of Disruptive Behavior, PMDB. Respond to a Code Gray. Designated staff in adjacent units and outpatient areas will respond. The charge nurse, nurse manager, or a physician will serve as code leader on inpatient units. If the charge nurse is unavailable, the patient's assigned registered nurse will serve as code leader. Medical directors of outpatient clinics will designate a code leader who will manage Code Gray in these areas. Disposition and orders. Disposition and orders will be the responsibility of the physician. If the patient is required to be transported to the Uptown Division, a consultation should be made with the Uptown Division's officer of the day. If the patient is experiencing delirium or has an overriding medical problem and does not want to be transported to the Uptown Division, the physician who oversees the code will consider placing a consultation for the patient to be seen in mental health. The physician will document the consult or the consideration not to consult into CPRS progress note. The VA police. The VA police will prove useful in making interventions against potentially destructive incidents. Nothing in this policy should be construed to limit the ability of the VA police to respond to a conscious effort to protect life, property, and appropriate order. The overall assessment and interventions must be directed from the clinical standpoint, which considers the patient's neuropsychiatric condition and medical legal status. Training. The Medical Facilities Prevention and Management of Disruptive Behavior, PMDB, training plan indicates the degree and frequency the medical facility personnel are required to attend this training. The Patient Safety Coordinator will work in coordination with the members of the Disruptive Behavior Committee and PMDB coordinator trainers to determine the need for training. Mock Code Gray reviews will be conducted at such intervals to ensure the medical facility personnel are competent enough to thoroughly follow through with the procedures of these codes. Code Gray Evaluation Form. The form will be completed within 48 hours of the incident. The nurse manager, or charge nurse, is responsible for completing the form for inpatient units. The medical director, supervisor, or designee is responsible for completing the form for outpatient units. The Code Gray charge nurse coordinator will forward the original Code Gray evaluation form to the patient safety coordinator and a copy to the chair of the Disruptive Behavior Committee. Responsible service. The Chief Mental Health is responsible for the contents of this medical center policy. Questions may be referred to 706-733-0188 extension 6391. The policy can be found on the facility's SharePoint. References: VA Handbook 1160.01 Uniform Mental Health Services in the VA Medical Centers and Clinics, the Joint Commission Comprehensive Accreditation Manual. Thank you for completing this lesson. Please close the window and self-certify. And again, my name is John Gordon, and I appreciate your attention.